Labrum. Labrum. A thick tissue or type of cartilage found in the glenohumeral joint, shoulder joint, and the acetabulofemoral, hip joint, etc. The type of the shoulder joint and hip joint is a ball and socket. It goes all the way around the socket and in most areas, firmly attached to the rim of the socket, and essentially forms a bumper that deepens the socket and helps keep the ball in place. Examples: shoulder labrum, a thick piece of tissue attached to the rim of the glenoid, shoulder socket, a part of the scapula, in which the head of the humerus sits. These two bones are connected by ligaments that hold the bones in relationship to each other. Hip labrum, the cartilage that lines the acetabulum, hip socket, a part of the pelvis, in which the head of the femur sits. Types of cartilage in the joint: articular cartilage, white cartilage on the ends of the bones, which allows the bones to glide and move on each other. When it starts to wear out, the joint becomes painful and stiff, arthritis. Labrum, found only around the socket where it is attached. More fibrous or rigid than the articular cartilage, distinctly different from it. Structures or tissues around the joint: labrum, keeps the ball in the socket. Deepens the flat socket, the cavity of the flat bone, so that the ball, the head of the long bone, stays in place. The ball is much larger than the flat socket. Ligaments, tethers that hold them together to help keep the ball in the socket. Tendon of the biceps muscle in the shoulder joint. Examples of joint traumas: the ball may slide the way out of the socket. Subluxation, partially. Dislocation, totally. The causes: too small labrum in an individual, torn due to an injury. The labrum can be torn off of the bone. Labrum tear, labral tear, if there is an injury to the joint that tears the ligaments. Sometimes the labrum is pulled off of the rim of the bone as well, usually involving a subluxation or dislocation. Usually, the labrum does not heal back in the right location. Cf. posterior ankle labrum.